Hi, everyone. Chapter 12 today. Thank you for joining me. Quick little look at our chapter. Let's bring up our PowerPoint. There we go. Today, we're going to look at Eating Disorders, Chapter 12 in our textbook. And we'll take a look at some of the characteristics, try to understand them a little bit, and some of the treatments that psychologists, therapists, and counselors use. So the first one that probably most of you are familiar with is anorexia nervosa. And this is where we have long periods of time where our patients or clients or the people that are experiencing anorexia are having calorie restrictions. In other words, they're extreme dieters. Some of the two different types are the restrictive type, where they refuse to eat or engage in excessive exercising to prevent that weight gain, which they're trying to avoid. The other type is the binge purge type, where they binge food, but then have purging behaviors similar to bulimia, which we'll talk about in a minute. Obviously, these extreme calorie deficits can cause a lot of problems in our bodies, and the side effects of them can be very life-threatening. Bulimia is the other side of this, where we have binge eating a lot, uncontrolled eating of large amounts of food, and then purging, self-induced vomiting using laxatives or diuretics to do that, and then or fasting and excessive exercise to keep their weight down to where they want to be. Binge eating disorder is a recurrent episodes of binge eating without the compensatory behaviors. So they are just eating a lot, but they're not purging, for example. Let's see, here's a quick little table that's in our textbook comparing the different eating disorders. Let's see here, we'll keep going here. Oftentimes, eating disorders will hit us in our males and females in puberty, when we have some changes in our bodies happening due to the hormone changes during early adolescence, puberty. And oftentimes this is a time when self-esteem and self-identity, concepts that we're building during these times can be distorted and can lead to these controlled eating and behaviors, so that we can somehow get the body that we think we want, is part of what's going on here. Social norms and social media oftentimes are blamed for some of this, a lot of a lot of distorted thinking about our body image as part of the cognitive part of eating disorders. Family dynamics are also important. How your family or your culture or your particular ethnic group thinks about eating or about body type, and can be very influential in this. Cognitive behavioral therapy is really good, and family therapy is often used to help the whole family, because a lot of times eating disorders is a family disorder. We'll keep going here. And we are done. A quick little look at them. Thank you so much for taking this quick little look at eating disorders with me. I'll see you in the next chapter. Bye for now.